Here a more typical example of enhancement associated with a cyst is shown. And in this case, rather pronounced shadowing, perhaps even more conspicuous than the lesion itself, is seen in association with a small cancer. In this example, careful inspection shows both scattered areas of enhancement as well as shadowing, representing a combined pattern, also related to an invasive cancer. Lesions may be associated with changes in the surrounding soft tissues. These include compression of tissue around the mass, obliteration of tissue planes, changes in Cooper's ligaments, the echogenic halo, which has been described in the boundary descriptors, and edema. Ducts may be shown to have abnormal caliber or branching. Cooper's ligaments may show straightening or thickening, and increased echogenicity in surrounding tissue or reticulation of the tissue may be seen in association with edema. Architectural disruption of normal anatomic planes is often seen with cancers, and occasionally skin thickening, either focal or diffuse, indicated by thickness of skin greater than 2 millimeters, except in the periareolar area, as well as occasional skin retraction and irregularity. Here an intraductal mass, an intraductal papilloma, is seen within a dilated duct. In this example, there is distortion of the Cooper ligaments caused by desmoplastic reaction due to the underlying invasive cancer. The Cooper ligaments are contracted and drawn into the area of the tumor. In this example, a subtle mass interrupts the Cooper ligament, which suddenly disappears in the middle of each image at the location of the mass. In this case, architectural distortion is evident by the disruption of the Cooper ligaments, as well as the change in the orientation of the Cooper ligaments as they approach the invasive cancer. And another example showing similar findings with distortion and displacement of the Cooper ligaments. In this case, skin thickening greater than 2 millimeters is associated with an invasive cancer. Ultrasound is not ordinarily viewed as an effective means to evaluate the breast for calcifications. However, when areas of calcification are seen mammographically, they can often be localized and identified with ultrasound. Calcifications may be described in terms of their size, with macrocalcifications applied as a term to be used when calcifications are more than 0.5 millimeter in diameter. These are often coarse and will attenuate sound, causing shadowing, and are commonly seen in fibroadenomas. Microcalcifications, or calcifications less than 0.5 millimeter in size, may be seen within masses or may be seen outside of masses, in which case they may be less conspicuous. This panel shows 3 patterns of microcalcifications. On the left, a coarse calcification with shadowing associated with a fibroadenoma. In the center, microcalcifications, in this case also associated with a fibroadenoma. And on the right, subtle calcifications not associated with a mass. Here a typical intraductal carcinoma with microcalcifications is seen. And here, subtle findings of calcifications without a mass is seen, corresponding to an area of abnormality noted on the mammogram. This example shows several small microcalcifications within a mass corresponding to those shown in the specimen radiograph on the right. In addition to these findings, which are commonly seen with breast lesions, a number of unique findings are occasionally noted. These include clustered microcysts without a discrete solid component, complicated cysts, which may contain mobile internal echoes and or fluid debris levels, masses within the skin, including sebaceous or epidermal inclusion cysts, foreign bodies, including silicone, clips, wires, catheters, and so forth, intramammary lymph nodes, and axillary lymph nodes. Finally, the birads ultrasound lexicon comments on descriptors to describe vascularity within a mass. Vascularity is normally compared with the contralateral breast in a similar location, or within the same breast in an area of normal tissue, comparing the vascularity of the mass with the reference tissue. Descriptors for vascularity include none, no flow seen with color imaging, flow within the lesion, flow immediately adjacent to a lesion, or generally increased flow in the surrounding tissue. The birads lexicon includes not only description of the features of masses and appropriate terms to be used to describe these features, but also comments on how these terms should be used to generate a final assessment and management recommendation. The report of the ultrasound findings should reference the clinical history, prior studies if available or pertinent, the studies imaged and evaluated, the types of other imaging studies that are included in the overall assessment. Most often this will be mammography, but may include correlation with other imaging studies such as MRI, concluding with an overall assessment category and appropriate management recommendation. The description of the lesion should be in accord with the lexicon, indicating the type of breast tissue in the area of concern, the lesion's size measured in at least 2 dimensions, the location of the lesion using a consistent and reproducible system, and a concise characterization of the lesion using the birads descriptors. The ultrasound findings should then be used in conjunction with the mammographic and/or MRI findings to determine a final assessment. The overall assessment and recommendation management should reflect the most suspicious features of the studies performed. Final assessment coding is in accord with the birads approach. A code 0 indicates an incomplete study which requires additional imaging evaluation. Birads 1 is a negative study with no findings, warranting routine follow-up for the patient's age. Birads category 2 is a benign finding, also resulting in routine follow-up for the patient's age. A birads 3 code is assigned to a lesion which is probably benign. However, short-term, usually 6-month follow-up should occur in these cases. More suspicious lesions include birads 4 lesions and birads 5 lesions, which have varying degrees of increasing suspicion for malignancy. In each of these cases, tissue sampling with biopsy is required. In summary, the birads ultrasound lexicon has become an important adjunct to the birads lexicon for mammography in the evaluation of patients with breast lesions and in the increasing use of ultrasound to complement mammography in this evaluation.